Hello, this is Dr. Do again. This video is on alphabetic list of problems on letter L, and I had a previous video talk about the lung and lung diseases, particularly introduce about the structure of the lung, explain the structure of the lung in association with the trachea and also the bronchi because of the heart. So that's the angle of the bronchi from the left and right lung. There's a difference that affect the many conditions for the aspiration or the foreign body, for example. And today I'm going to move on to talk about the very common diseases, pneumonia. There are different kinds of pneumonia, either acquired from the community or acquired from the hospital because of recently hospitalized or working in the hospital or in the long-term facility or senior living places. So those are the because the difference of the community-acquired pneumonia versus the health facility associated or healthcare facility associated pneumonia, in terms of the causative pathogens are different, and of course the clinical presentation will be different because of this different environment, particularly for those patients has other comorbidities. So then the consequence and also the mechanism, the causative pathogens are totally different. So basically, it's not hard to understand. Pneumonia, the inflammation of the lung, usually for the healthy people, either children or adult, usually the most common one of causing pneumonia is still the viral. But a lot of time, if the virus causing pneumonia not recovered, not treated in time fashion, because particularly for those who have the mucus sputum, because the mucus and sputum are one of the best media for bacteria. So a lot of time those viral caused pneumonia, if not treated well, can be complicated to the bacteria pneumonia. So that will bring up the serious conditions compared to viral pneumonia, which really the care is emphasize on the supportive, keep the bronchi open, keep the sputum up, coughing up, not accumulating the lung. So then, and also keep very well rehydrate with the fluid. So these are the fundamental measurement for the viral caused pneumonia. In terms of symptoms, it's also compared to the viral versus bacteria. Of course, the symptoms is not that severe. Both of them can have fever, coughing, with or without mucus. The difference is like previously, I think I mentioned, in general speaking, viral infection versus bacterial infection, really the generalized symptoms is not severe. For bacterial infection, usually you feel very sick, feel malaise, which means feel fatigue, and the fever is hard to brought down by the medications, and coughing usually from the large amount of mucus compared to the viral caused infection, of course depending on the pathogens. So this is in general, and in terms of emergency situation, I think I already mentioned on the previous video, so I'm not going to, or just briefly to mention again, if the fever cannot brought down by the medication, particularly lasts for more than 3 to 5 days, get it checked, go to your physician, or the coughing associated with the chest pain, severe chest pain, and you feel the cough is really deep, and also associated with the difficulty breathing, or associated with change color of the skin, particularly the tip, the lips from the usual red or pink into the cyanosis, which is blue, and gasping for air. Those are the signs really need to see the physician, even though it's a viral infection. But because of the sputum and the mucus cannot, if it's not coughing up, so then the mucus accumulated will, on top of that, will complicated by the bacterial infection. So if you see the physician, even though no antibiotics, but can probably use some give you some advice to moisture the air, to keep the trachea or bronchial open, use some dilators, so then the sputum can be drained out, also to limit the bacterial infection. So this is for the healthy adult or children. If you have this kind of deep, you feel like the coughing from deep instead of the upper respiratory tract infection, and really you see physician, even though without, like I said, without antibiotics, but still they give you advice how to manage, how to drain the mucus, how to shorten the time and improve the prognosis. So this is the most common one, viral caused. And also bacteria can also cause community-acquired pneumonia. For the healthy people, the most common, of course, strep bacteria, and also some other kind of bacteria. Depends on the patient. If, for example, if patient tend to, after the stroke, or tend to drink, lost consciousness and deep sleep, and the aspiration can cause this different kind. I think I previously mentioned Klebsiella bacteria is one of the causes of this, and other bacteria. Or for the young people, there are some other non-typical bacteria or typical pathogens that also can also cause this pneumonia. In terms of management, I think if that's, like I said, the symptom of this bacteria or a typical pathogen caused pneumonia, usually can feel worse, especially bacterial infection, strep, can cause very serious, feel coughing very deep from the thoracic cavity, and feel hollow coughing, or chest pain, may or may not associated with chest pain, may or may not have difficult breathing, the fever cannot brought down, and feel very sick, the patient, either young or adult. For the young children, there's some other, like Haemophilus strains also can cause this bacterial pneumonia. So, regardless, if the fever, coughing associated with chest pain, with or without chest pain, with or without difficulty breathing, and the fever cannot be brought down and feel very sick. So those people, even though you do not have any other medical problems, but still need to see a physician. So make sure the physician will examine you, and empirically, actually, because the culture of sputum takes time, and a lot of time was not positive. But empirically, a physician, based on experience, will judge whether it's bacterial caused or it's viral caused. So we'll give the medication treated accordingly. And for the other groups, like which referring to the health facility acquired pneumonia, either from the senior livings or just recently hospitalized or working in the hospital, for those group, or some other for some other pneumonia caused occurred in the patient with the comorbidities, I'm going to talk about it the next time, because those group of pneumonia has a different kind of pathogens, and the consequences, and in terms of management and consequences, will be different. So I'm going to talk about next time on those group of pneumonia. So I'm going to stop here today, and thank you for watching. I will see you next time.